right, I'm Jared Moore for Mvskoke Media, and this is Live Wire. We're going to have a COVID vaccine update today with Dr. Beets. He is the Chief Medical Officer for the Muscogee Creek Nation Department of Health. Dr. Beets, thanks so much for joining us today.
Thank you.
So I guess the major thing that's going to come up immediately is the Expo Square. There's going to be a big event where the Department of Health is going to do vaccinations by appointment, and it's going to be open to everybody 18 and over, even if you're non-Creek. Is that true?
That is correct. The River Spirit Expo event is going to be tomorrow, Friday, and Saturday from 8 to 5, and it will be open to everyone who is 18 or older, regardless of your Native American status.
So what do people need to do to participate in this event? How can they get signed up, and do they need to be signed up ahead of time?
It is preferred they be signed up. About the most lengthy part of a vaccination event is the registration of the individual. So it is helpful if they contact the number which has been released to the public to pre-register. That way we can, obtain their data in regards to their date of birth, etc. And then when they come in, it streamlines the process and makes things move faster.
And I've put the number up there in the corner. It's 918-758-3601. And I think that's also the general COVID information hotline, if I'm not mistaken.
Yes, I believe so.
So, in your opinion, how is the vaccination process going? We've seen the numbers in Oklahoma go down, and that could be a seasonal trend, but how from your perspective inside and working on the front lines, how is it going?
Well, the vaccination events that we are having continue to be much smoother. Initially, there's several different vaccines that were being released, and they have different parameters that you have to follow, different age groups you have to follow, different numbers of dosages in the vials that we were provided, whereas Pfizer has 10 doses in a vial, Moderna has 5 doses in a vial, and it's very specific in that once you remove that vial from its place of refrigeration and or freezer, and you puncture that vial, you have 6 hours to use the vaccine's dosages that are inside those vials. So at first, when we first started trying to get everything streamlined in regards to working with emergency management internally and with the tribe and the tribal communities, it was basically to make sure we had enough people registered that we weren't wasting any vaccine. As time has went by, the process has gotten much smoother. Just like with anything else, you have your bumps when you first start, but much smoother, very little, if any, wastage. And, the patients have learned the process as far as registration and been pretty consistent and following up for their second dose.
Now, we've seen a new vaccine come out, the Johnson & Johnson vaccine, which is a 1-dose vaccine, and it has a lower efficacy rate. I think it's 60% compared to the Pfizer, which is 95%. Are we going to see the Johnson & Johnson come down here, or what? Do you know anything about the status of that?
Yes, actually, we are going to see the Johnson & Johnson vaccine. We call it the Janssen vaccine, and it is a single dose. Yes, it does have a difference in its, reported effectivity rate. The Janssen dose, the latest information I have, shows that you have a 66% decrease likelihood of contracting COVID if you take the dose. But with that being said, there are other studies have shown that you have approximately, if you do still contract COVID after receiving the vaccine, then you have an 85% decreased chance of having a severe illness that will require hospitalization or any other type of adjunctive treatment.
So with the Johnson & Johnson, when we get that down here, will that be a situation that'll be the same as how the the Pfizer and the Moderna have been, where citizens will call a phone number, they'll get schedule a time, and they'll come through and get injections, or will it be something where someone could just come into a clinic and get the shot?
Actually, all of the above. The citizens can call and schedule an appointment, obviously. Secondly, one thing we have been discussing in regards to the Janssen vaccination, since it is just one injection, is contacting the tribal communities or other entities in our communities, and then taking that vaccine to that particular community and providing that injection right there on site. It's a little bit better in regards to the patients not worrying about having to come and get their second dose, especially for elderly individuals who may not be able to travel, rural areas, etc. So we are planning on being able to bring that vaccine through our resources. We actually have two new, I wouldn't call them vans, they're much larger than vans, but they're smaller than buses that actually have exam tables, refrigerators, etc. in them that the Department of Health has purchased. And we will be utilizing those to go to communities and providing injections.
So, with the drop in the infection rate in Oklahoma, just in your opinion as a medical doctor, do you have any idea when we might expect to see things like the complex be open to citizens, or just those type of things? Like, are we coming out of the woods? Are we still in the woods? What do you think?
Well, I think that's a difficult question to answer because it involves a lot of speculation. As far as the tribal side, with the tribal facilities, executive building facilities, etc., that is something that the executive office, the chief and his colleagues and his advisors will determine as far as bringing back the employees full time, etc., and then when they will open up the various lobbies, etc., to the citizens to come in to receive services face to face instead of having to do things online. As far as the COVID-19 numbers, they have, based upon the data that we've seen, and we work with a group called My Health, which the tribe helped found here in Oklahoma. It's a health information exchange group, as well as looking at the CDC numbers, Indian Health Service numbers, the state of Oklahoma numbers, to try to determine, what our positivity rate is, what we're seeing trending in our testing in our facilities, but also in the communities that are around us. Yes, there has been a trend down in positives. There's been a trend down in hospitalizations quite significantly. And one can speculate on what the cause of this is. Could it be because of the vaccine uptake? Last numbers I saw in the state of Oklahoma, over 1 million Oklahomans have already received their first vaccination. And then on top of that, you have approximately 500,000 Oklahomans who contracted COVID-19. And there's been some just discussions in the scientific community in regards to, well, how many people actually had COVID and were never tested because their cases were mild, especially in your younger individuals. So how many people can you top on top of the 1.5 million that potentially have had COVID and are now, possibly immune? And so when you get those numbers together, it starts to have a significant impact on our positivity rate, our hospitalization rates. And, if you listen to Dr. Fauci and some of the federal officials, they're stating potentially in June, we could have quote unquote herd immunity or have reached a tipping point where we can get back to some semblance of normalcy. If you listen to other experts at Johns Hopkins and Stanford and at Harvard School of Public Health, they even question if it could be late April that we can get to that point. But I think one thing that the public needs to be aware of, and I'm in the same boat as them, frustrated about having to wear masks, having to mitigate, constantly not being able to see loved ones go out and do things that we would consider part of our normal lives, is that there are mutations sometimes with viruses. And so far there's been three major, there's multiple mutations, but there's been three that have really kind of hit the news. And the question is, do our vaccines protect us from those variants? Initial evidence from some of the pharmaceutical companies is promising that yes, potentially to do. They may have to have a booster or rearrange some of the vaccination components to help protect us. So even, with seeing the numbers down, which we're all thankful for that, seeing the number of deaths go down, we're thankful for that. I think we need to continue to wear masks, wash our hands, try to do some social distance and mitigate the chance of spreading these new variants. And hopefully we'll get there, to where we won't have to do everything that we're doing currently. One interesting thing that Dr. Fauci had said in the past, and I agree with him, is that the government is never going to come out and say, okay, everyone stop wearing your masks. It's basically going to be a general drive from the population that they start to feel safe enough to where they don't typically do these things like wear masks, etc. And he was speculating that would probably be in the fall sometime, but it remains to be seen.
Well, from your perspective, do you think we're winning the war?
Yes, I think we're winning the war. I think
Great.
we're winning the war. It's a battle at a time. We will win this war. We're going to have lost loved ones along the way. It's going to have changed our society permanently in a lot of different ways, the way we interact, technology, our jobs, etc. And we have to realize too that our people before us fought this war in many ways. The Spanish flu in 1917, the bubonic plague back in the Middle Ages, Ebola. We always win the war eventually.
And I want to take a second to mention to the audience, we're taking questions from the chat. So if you have a question for Dr. Beets, just pop it into the chat. We'll ask and we'll see what the answer is. I don't see any questions from the chat currently. It's interesting that you mentioned the historical perspective of this, and I wonder if there's been any data observed that separates the Native American populations from the general populations because of, we've seen studies in the past about pain tolerance and other things like chronic pain tolerance, that there's a higher rate of chronic pain in Native American communities and other things like diabetes and stuff. Have you seen anything interesting about that in relation to this pandemic?
Not. Well, I mean,
just anecdotally.
Because the pandemic is new, obviously there's not a lot of scientific evidence out there or the time to do the studies, to kind of look back and go, okay, this, double-blind studies, retro studies. Yes, anecdotally, there has been, some discussion that Native Americans are we're much more susceptible to COVID-19. What is the cause of that? You could say it's socioeconomic factors because a lot of times we have multi-generational homes. You could say because it's rural areas, where individuals may not necessarily have total access to health care. And it could also be our genetics. And that discussion could go on for hours in regards to, do our genetics put us at an increased risk? I mean, we know factually that our genetics potentially put us at greater risk for diabetes, coronary artery disease, obesity, nicotine dependence. 35% of Native Americans in the state of Oklahoma smoke versus the population, which is about 20%. So I think that it's multifaceted. I think part of it's genetics. I think part of it's socioeconomic. I think part of it's cultural. And, we will see more down the road. I think one thing that, we have seen among the clinicians is that quite a few, I've had family members that have passed in the tribe, and several friends have, of course, and is that once contracting COVID, the severity of the disease among Native Americans. Do we have an underlying genetic component or that would cause us to develop things like blood clots, etc., or have a much more severe disease? I don't know that all those questions can be answered, or if they're ever will all be able to be answered. But yes, there's definitely been some initial information that states that we are at much higher risk for contracting COVID. We're also at much higher risk that once we get COVID of passing COVID.
Well, I just want to say, sir, I'm sorry for your loss, and to the audience, anybody who's lost any of their family members or friends to COVID is a horrible thing to happen, and hopefully we can get this over with sooner rather than later. I don't have anything else on my list. I do want to go over the event details again, and if you're watching this video, in the description at the bottom, there's a link to the Department of Health's website that has all these details, along with the number that's up in the corner of the screen. But the event is going to be at the Expo Square in Tulsa. It's going to be the 26th and the 27th. You can register online or with the number, and it's appointment only, but it is open to anyone that is 18 or over, whether you're a Native American or not. And Dr. Beets, I want to thank you so much for coming in today. It's been a great interview. And is there anything you'd like to add or tell the audience in relation to this stuff?
Well, a couple of things. I would tell you that you have a great team here in the Department of Health that have worked tirelessly, many hours, along with the tribal executive branch and you know, the council, et cetera, to try to prepare our people, protect our people, take care of our people. And we have so far approximately 22 to 23,000 vaccinations have been given to our citizens as of Monday. And also we've been testing pretty proficiently in regards to our population. So far we've tested 37,271 people, and we've had 5,270 that returned positive. And I encourage everyone. I know it's frustrating, especially now that the summer season is getting ready to start, and we're a very societal people. You know, people not being able to go to their churches, not being able to go to stomp dances. Hopefully that will get better this summer, and we just need to continue to fight and remember those ones that we lost, and take care of each other.
Well, thank you once again, Dr. Beets, and we will check back in with you guys in maybe a month or so and see how everything's going again. Maybe we'll have even better news then. So to the audience, if you need any more information, the link is in the description, and we appreciate you tuning in today, and we will see you again in the future.